What is up, guys? We have Casey here again.
Again.
Yeah, you're here like
I'm making a pest of myself.
No, not at all. This is fun. I think it's important that people understand, especially now with what's going on after COVID. Companies are having to adapt to employees. You have employees that are choosing to stay home and work. I know you have, different employees that are all around the world doing different things.
Yeah.
But when you look at employees here locally, here in Albuquerque, this is a question I wanted to kind of hint around with you. Why is direct primary care so important now, probably like more than ever?
So I think COVID really highlighted that our healthcare system was pretty broken, and a lot of clinics actually shut their doors for a while we were trying to figure out what was going on. And so people actually couldn't even access their healthcare. And clinics like direct primary care, they just kind of chugged along. Everything was actually kind of normal because we were already set up for remote, and we made healthcare convenience. There was texting, and the fee-for-service model just isn't really great. I mean, these clinics, they didn't even know how to get reimbursed because insurance companies don't reimburse for telephone visits. And direct primary care didn't have to worry about that. We don't rely on a third-party payer to keep our doors open. And
that's just they pay the monthly.
Yeah, so the company pays the monthly fee for the employee typically, and the employee just has great access to healthcare. And access is probably our biggest value.
So whenever you're looking at, I think the biggest issue always is getting quality employees. And
yeah, true.
And we know in New Mexico, that's a issue that we face here. So whenever you want to recruit and retain a quality employee, why is DPC or direct primary care? Why is it so important in being able to keep an employee?
Yeah, so there's lots of studies out there, and most of them conclude that health care benefit is the number one benefit that employees are looking for. And I want people who are listening to this to understand, to think that health care doesn't equal health insurance. They're separate things. And so whenever I say to somebody that I'm having a discussion with them, I'll say, who's your healthcare provider? And most of the time they'll be like, well, Blue Cross Blue Shield, United Healthcare. They'll list off their insurance company. And it's just kind of sad because that's not your healthcare provider. That's your health insurance. And if you were telling me about your car, you're not going to be like, yeah, I have USAA. You're not going to tell me about your car insurance. So it's kind of weird from my perspective to be like, no. Who's your primary care provider? Who's your healthcare provider? And so kind of lost my train of thought there, but
no, because people need to understand this. There's a division between this. Health insurance is expensive.
Yeah.
Direct primary care, those visits that you go to, I've got the flu, I need, I don't know if I have diabetes, can I get that checked? Blood work, all of those things. That's primary health care. That is not expensive, right?
That is not expensive. So a company we can serve two different types of companies. One is a really small company that they just want to compete with the big guys. They're just trying to offer a health care benefit of some sort. And direct primary care is highly valuable. It's $75 a month per employee, and that's it. The employee comes in, they might get some labs, they might need medication, but most of it's affordable. And their visits are completely free. There's no insurance claim. And so if that's all you can offer as a company, that's a good ad. That makes you competitive. That would, if I was interviewing and asking about your healthcare benefits package, I would be like, oh, that's interesting.
So I'm a small company. I have 25 employees.
Yeah.
I'm local. I'm here in Albuquerque, and I can't afford health insurance. Mm-hmm. So the next thing is...
This is something better than nothing. The other way direct primary care helps companies is the larger companies, and they tend to be around 50 plus where they start to become something that's called self-funded. And so they're paying actually for the actual healthcare. The employee goes to the doctor, there's a claim for $250. The company's actually paying the $250 out of a pot of funds over the year. And direct primary care can really save them a ton of money. We're not suggesting they get rid of their health insurance plan, but we can save a lot of money because we can take a lot of the inflated claims and just bypass that whole system.
So it's separate.
Yeah.
Yeah, because that's a key to understand that. Yes.
And then your employee comes to see us and we're like, okay, they need these labs. Now, if those labs were charged through the insurance column, if you will, they're going to be over $1,000 probably.
Right.
They cost about $130 when you pay directly to us because we have a relationship with the lab. We have a financial agreement with them that things are going to cost this much, and it is significantly cheaper than what we see on insurance claims on explanation of benefits.
Yeah. And I know I want people just real quick to understand direct primary care. And, some of the things that I've experienced going to the clinic is the, 30, 45-minute visits. Yep. Instead of the 10 or 15 and shuffling around from each room. And you usually see, who's the person that takes your blood pressure? What type of person is that?
Usually a medical assistant.
Yeah. You see a medical assistant. You'll see them probably longer than you actually see the doctor.
Possibly.
I think last time I saw the doctor was really like 4 minutes, and then they don't have, the model.
Oh yeah.
And how it is. I mean, you were involved in that rat race. They don't have time as much as they want to. They don't have time. And I'm experiencing that with my mom. It's very interesting. It's Kaiser Permanente, but in Washington State, but they have so many cancer patients just to be able to take the time to look at the charts. How do you when are you looking at the charts? And they're doing it at home, and she's getting a 9:30, 10 o'clock email from the doctor. So he's worked 12, 15-hour days. Yeah. Now he's at home going over your chart, super tired.
Right.
I'm just like, and I'm not questioning them. I'm just saying with that model, what is the level of care that you're getting?
Minimal.
Yeah.
Most likely. It's exhausting. It's causing massive burnout. Providers like me, nurse practitioners, doctors, they're leaving primary care. They're not staying in it. They're specializing. They're retiring early. And so this future problem we have of a primary care shortage, actually we have it right now. It's just going to get worse. It's actually going to get worse because it's just people are working way too long. It's not sustainable.
Right. And then also the wait time. And we had talked about that, a little bit, but that's so annoying sitting there. And they do that on purpose. They reset you in each room. So it resets your clock. We even talk about that. Yeah.
Yeah. It feels like you're making progress.
Yeah. And then because they're either double booked, and visits, they go a little bit longer than the other one.
Yeah.
You can see that with dentist office too. They're doing the same thing, but usually they can pretty much handle it for the most part, stack people in there. And, you're just focusing on one thing.
Right.
You're having to deal with symptoms of a whole body.
Right.
And then you have, until we have AI strong enough to be able to assist or help with the doctors, most of the time you're going off of your education and a hunch.
Yeah. Is the reason fee-for-service clinics, the insurance-based clinics, they get reimbursed such a tiny amount for each visit. So they have to really cram you in there. Now, if somebody doesn't show up, they've lost money because that space could have been filled. So what they do to combat that is double book.
Right.
And so that's why you're waiting so long, because the provider can't be in two places at one time if everybody shows up. And so that's why that happens. Of course, there's little emergencies here and there. Right. But most providers these days, it's the administration that's making these schedules. Like, you have no control over it whatsoever. No,
and to be able to, like what I experienced, to be able to text, like directly text, like I text Jamie, and then she did my prescription for me, and then I couldn't make it there by 5, so they put it in a mailbox for me.
Yeah.
And then I picked it up at like 5:40, 5:45, but I had this freedom to be able, so I got a response right away, in like 15 minutes.
Yeah.
And then from there, I couldn't even pick it up on time, and I was going to have to wait the next day. And so then I was able to. You don't get that flexibility and that level of service.
Nope.
You're not going to get that anywhere else.
Nope.
Yeah, so I think that's cool. So on the calling and texting, do you have it set up directly with each of the providers? So and then they're answering, or do they take shifts? Because you have that. Where they can text and call.
Yeah, so you have access to your actual provider, her actual text line during the day. And then in the evening, one of us is on call, so either me or her. So you still kind of have access to us. And then when it gets later, there's 24/7 telemedicine product as well that you have access to. So if it's 2 a.m., you can still access healthcare. Yeah,
I was talking to an owner of a business the other day, and he was complaining about this, so I happened to mention you. But he was talking about the level, like Presbyterian and some of them, of how far out the appointments are right now.
Yes.
Because they're trying to catch up and stuff. And so they're doing like month-and-a-half appointments. Mm-hmm. So this is crazy what you have at the clinic. You have next day?
Same day, next day.
Next day?
We always reserve it for members. So there's always a slot just kind of sitting there in case somebody needs it, because we're not sitting there going, oh gosh, if that fee for service, that person doesn't come in, we need to fill that slot. We can't let that. Our finances are pretty stable because it's a monthly membership.
Right.
It is what
You're
it
like
is.
Costco.
It's And so we don't have to be hectic and crazy. We
Right.
can say, okay, we have these members. It's like you prepaid for that slot. And if you need it, it's there for you.
Yeah. And that's cool. So you can do same day. And if they can't come in, you can do phone visits with them.
Yeah.
Same day, next day. So that's really cool. But this one, I think a lot of employers don't understand this, is the out-of-pocket costs for your employee. Because the big deal, a lot of these small businesses, your employees are living paycheck to paycheck.
Yes.
Because, if you look at what you're paying them, and that's great, but you have to understand they're living paycheck by paycheck.
Right.
So to go into a clinic and then get a $200 bill,
they won't do it.
They just won't get the medicine.
They just won't
Is
get
that what
the
you're
care.
seeing?
Well, yeah, they maybe not even want to pay the copay, but aside from the copay, at least they know it's $20 or whatever it is. They're afraid of getting that surprise bill, getting that denial from the insurance companies. But when they're seeing us, we're like, okay, first of all, the visit's free.
Right.
There is no insurance claim. So you're not going to get some surprise bill for the visit 3 months from now that you can't afford. And if your medication is generic or, if it sounds not a crazy medication, like this is how much it'll cost you. And if we can do the best cost, you'll get it right here. If it's better for you to use a coupon and take it to the pharmacy, we'll tell you, because we can tell in real time what's a better, more advantageous method. And then our labs, we're able to tell you the price beforehand, which is like, that's never been done.
So if you want to go get blood work, or you need blood work, or
you just get it in our
you need
clinic
to get something tests. Yeah.
This is how much it'll cost you. So now you can truly make an informed decision. One, we're telling you need these labs, but two, this is how much it costs, because your pocketbook matters to you as well.
Yeah. And you had talked to me about a case study, and I know, as far as like how they love the program, and I know that you could go on, your Google reviews and see that, and you can talk to, you could just feel it's a whole different environment. Like your dogs are running around and it's like really laid back and everybody's really nice.
Yeah.
It's kind of more, it's more of like a homey, I wouldn't say it's informal, because you guys are still professional, but it's just like that caring attitude that you have,
Yeah.
And because there's not the pressure, the stress to hurry up, next,
on the employees
next.
or the patients or
you never walk in your waiting room and there's 10 people waiting, coughing
and
on
you're
you,
like,
and
oh no.
take a number. We'll get right with you. Yeah. You don't see that at all. It's rare that you have one or two people.
Yeah. That is rare. And that's usually because it's our infusion clinic, or somebody's waiting to pick up a person from the infusion clinic. It's not even the Well-Life clinic that's waiting. It's the other clinic that's under our roof.
Yeah. So pretty much you're going to have the whole waiting room to yourself.
Yeah.
When you're there, your employees are going to have that.
I think we have 3 chairs in our waiting room total.
Yeah. It's not. So,
employees love direct primary care. They're just blown away by it. They did a study. So the city of Arvada in Colorado, it's a suburb of Denver, they signed on with a direct primary care clinic. They went all in, and they're a self-funded. So they stood to save a lot of money to bypass those insurance claims. So this was a big program, and they wrote this really nice white paper on it. And they had done an employee satisfaction survey, doing the Net Promoter Score, which is not just used in medical, but it's basically a score of satisfaction, excellence. And anything above 50 is considered excellent. That is a great, fantastic Net Promoter Score. Well, the direct primary care in this particular case study, the Net Promoter Score was 70. And so it was outstanding. It was beyond excellent. So the employees love it. And our employees we have from the different companies around town, they all love it. They love it.
Yeah, and I think it's, and it's not only that, but it's simpler than people think.
It's very simple.
Yeah, and that's something. It's like, well, I don't want to change this, or as an employer, you're like, I don't want to upset the apple cart. We've got the insurance. I finally figured all that. I went, this took 3 years, and we're finally stabilized.
Yeah.
So to make sure that people understand this, I want to kind of get into, what would be the next step. Like an employer says, oh, okay, I'm kind of sold on this. I kind of want a little bit more information.
Yeah.
What would be the next step?
So every company is a little different. I acknowledge that. Some have benefits, some don't. Some are self-funded, some are this, some are that, and some are complex. But we basically sit down and meet, and I hear what you're trying to accomplish, and I kind of explain that, this is how our little puzzle piece will fit into your little puzzle piece. And if we're a good match, most of the time we are. There's a way for us to fit into your program. Sometimes we're not, but most of the time we are. And so we do that, and then that's just about all you have to do. Like you say, okay, let's do it. And I create a little company profile, and I send you a unique company link for your employees, and you let them know, sign up. for this new great program. You're going to love it. And then from there, we start to market it to the employees because the employees don't understand it either.
Right.
But we try to take on all the work because the last thing you need, the last thing your HR person needs is more work.
Right.
And so we really are the ones that try to, and plus you also don't want as a company to be over your employees being like, you have to sign up with this provider, because you want them to feel like they have choice and stuff. So it's better if it comes from us. It's not, because employees will sometimes look at their employers with distrust. What's this program? Oh my God. Like they're thinking, oh, this is going to cost me some more money, or the benefits are going down, not up, because that's all that's happened for the past 10, 15 years.
But I think it's really cool. I mean, so let's say you have 30 employees or whatever, $75 a month. That's what it is. But do you see different ways that employers are handling this? Are they dishing the costs off to, the worker? Are they splitting it? Are they doing different things?
A lot of my companies, they want to have some buy-in with the employees.
Right.
So they want them to pay a small piece. So one company's doing $10 a month. But
but that's great though. Yeah.
But it's buy-in. Yeah. But I encourage them to pay the whole thing because employees don't understand it. The employer barely understands it. And
they're not going to know till they have the experience that they go there.
Yeah. So what has to happen when they charge a little bit is they'll have the early adopters. A couple employees will like, okay, I haven't seen a doctor in a while. I'm going to try this out. And so then they'll go and then they'll tell their friends and then it blossoms from there. Well, so it takes longer to roll it out. But
and I could see an issue. I could see an issue if you're $75 and then you have a wife and 4 kids or a partner and 4 kids.
Yeah.
That could get really expensive. Is that $75 each?
No, it's only $30 for the additional.
Really?
The additional member.
So it's $75 plus $30?
Mm-hmm.
And then it's per child is the
per child is 30.
Yeah, 30.
Yeah,
okay,
up to 4, and then we start to do cost breaks and stuff. Because if you have more than 4 kids, you need cost breaks.
So what is they can go to welllifeabq.com.
Mm-hmm.
And then what's your email address if like a CEO or somebody, an HR person wanted to talk with you directly?
Yeah, so it's KC, just like Kansas City, just my initials, KC at welllifeabq.com.
Yeah, and it's easy. You can go online. You can even go online and enroll if you're an individual or...
Yeah, if you're ready to go, you can just hit the enroll now button. But
and then you can do it all online. It's real simple.
But if you're a business, we should probably meet first.
Have a conversation.
Yeah.
I have 100 employees and I just decided to sign up.
We did. A business recently did that. They were small, thankfully, and they just kind of snuck in as individuals. And then they're like, why is this invoice all messed up? We're like, whoa, where'd you come from? And so I think that was yesterday or the day before. Time flies. I called her. I was like, let's get a few things like ironed out here so that July goes a little better than June. She's like, okay.
So it'd be best to have a conversation with you.
Yeah.
So if you're a business owner or you're in charge of that, because a lot of human resources peeps are in charge of that, and that's stressful.
Yeah,
I feel
for
you.
them.
Yeah, exactly. Cool. So Casey at Well Life ABQ, or you can go to, if you want to find out more information, you can go to welllifeabq.com. Thank you.
That's right. Thanks.